So next speaker is me. Can I have the slide? Yes, here. I'm from Kyoto, Japan, and I'd like to talk about Twendee X, not for acne, but for voice. So can you go to the next slide, please? Voice is created by the vocal vibration, which is derived by the respiratory power. So flow vibrates the vocal, and then we have sound from the vocal, and then resonance system is very important to modify the sounds. Otherwise, the sound in the vocal is basically same with a different frequency. But each individual voice sound is created by the resonance system. So this whole system is very important for individual voice production in the human. Next, please. Vocal is kind of string of a guitar, and we have only one pair of a very short mucosa of the vocal. It's 2 centimeter length, and vibration is very quick. It's about 100 hertz up to 800 hertz in soprano singer. And can you, oh, okay, yeah, this is digital high-speed imaging, which capture the vocal vibration. This is three-dimensional traveling wave and very dynamic vibration. This is the only mucosa that can vibrate like this. There's no mucosa can vibrate like this. Next, please. And, not run the video. And also, we can check the vocal vibration by stroboscopic endoscopy. That's a special endoscopy like this. Oh, okay, go. John, go. Oh, no, go. And then you can see the length difference between the low pitch and high pitch. So we elongate the vocal mucosa as a high-pitched string of the guitar to create high-pitched sound. So this is a control inside of very few, very tiny organs of the vocal. Next, please. Next slide. One more click. No, one more click. Okay. So this fine mechanism is supported by the microstructure of a human vocal mucosa. This is a coronal section of the human vocal. It has layered structure consisting of the muscles and ligament and mucosa. So, X is the muscle. It supports the vibration. Vocal ligament is applied on mucosa. The mucosa has only 1 millimeter length, width, and mucosa vibrate on this structure. And vocal ligament supplies the good tension of the mucosa as a string of the guitar. Otherwise, we cannot sing in a high-pitched voice. So this vocal ligament only exists in adult human vocal fold, not in a kids, not in another mammals. So this enables us to sing so variety of pitch range. And also, we have hyaluronic acid and the vocal mucosa. This is essential for vibration of the mucosa. Otherwise, if we absorb the hyaluronic acid, there's no vibration anymore. So we need to keep this structure of the vocal to create the normal sound. Next, please. But damage of the vocal can occur very easily by vocal abuse, like a singer or professional voice users, inflammation, acute cold, or smoking, aging, and surgery. We usually perform vocal surgery, and this damages the vocal as minimum as possible, but there is damage on the vocal. So we need to repair the damage after that, but it's not so easy. Next, please. This is a model of a rabbit vocal abuse model. This study was done in Twendee in the US, and investigator used to be my junior people, and what they did then is to vibrate the rabbit vocals by flow from the tracheostomy. So the rabbits vibrate for 10 minutes, or 30 minutes, or 1 hour, And then they check what happens on the vocal mucosa, and they found the epithelial damage. This is the normal microprojection of the epithelium on the lower side, and then minimum damage or moderate damage or severe damage can occur by the power of the vocal damage. Next, please. And also they found that upregulation of a gene related to inflammatory cytokines such as interleukin-1 beta or TGF-beta 1 or COX-2 with more abuse, more loading of the vibration. Next, please. So inflammation or vocal abuse causes damage to the vocal fold. It's usually reversible, but too much damage can cause permanent scarring. In such cases, the vocal fold never vibrates forever. And also, we perform surgery to the vocal fold. This is CIS. Can you run the video? Carcinoma in situ, we usually do the resection of the vocal fold as minimally as possible. We first cut the epithelium and then dissect the lesion. And then we found the vocal ligament, underlying ligament here. And the ligament is intact, so we can preserve the vocal ligament intact and then remove the superficial tissues. This is minimally invasive surgery for the cancer or the vocal fold. And then the epithelium is gone and some tissues above the vocal ligament is gone, but the vocal ligament is preserved. In such cases, the post-op dysphonia is minimal. Okay, can you go to the next slide? Next one. Yeah, can you run the video? Can I have a sound? Sound. No sound. The right side is the operated side. There is some scar and the vibration is a little bit limited, but the voice is not so bad. Sound? Nope? Okay, I go next. Next slide. This is minimal damage, but this case is also underwent cordectomy for papillomatosis. That's a benign tumor, but the surgery is the same. Okay, run the video. Here is the lesions. Make an incision, and then dissect the lesions from the underlying vocal ligament. This is a recurrent case, so there is some scar, but the surgery is the same. To dissect the lesion from the vocal ligament and resect the lesion together with epithelium. Good. Careful dissection, preserve the tissues as much as possible, and remove the shallower portions. Okay, so next slide. But in this case, can you run the video? Severe scar occurs on the right side. There is no vibration. 2 months post-op, the voice is very bad. No sound as well? Okay. So we cannot predict how the wound healed after the surgery to the vocal fold. Next, please. There are only 2 fates of the wound healing for every organs, regeneration or scarring. Scarring is a good mechanism to protect the wound from the bacteria. It's a very quick mechanism, but we don't like scarring on the vocal fold because the voice is gone. So we need to regenerate the vocal fold after the surgery, and there are many elements that leads to regeneration, but it's really complex, not easy to do it. Next, please. Next slide. And this is histopathology. Oh, go back. Next one. Oh, yes. So, run the video. Oh, no. I have video here. Click. Oh, we have sound. So the voice is really bad with the scarring. And this is a permanent. We cannot have ideal treatment right now. Okay, next slide. This is a histopathology of the vocal scar. This is really same to the other portions in the body. And right side is a scar and the human vocal fold. There's no layer structure and hyaluronic acid is gone. There's only thick collagen bundles which forms fibrosis. That makes the tissue so stiff and hard. Next, please. There are three phases in the wound healing period: inflammatory phase, proliferative phase, and remodeling phase. Next, please. And there are many factors that affect the wound healing of any organs. We cannot follow everything, and even if we pick up something, it's not work so well. One click, please. One click. One click? Oh, no, one click. Yeah. And here we have reactive oxygen species, ROS, that affects whole things, that damage the cells and the cell function that produce extracellular matrix or growth factors as well. So ROS is basically very important to control for the better wound healing in any part of the body. Next, please. ROS is usually produced inside the body. That's important protective factor, but too much ROS causes many diseases such as cancer, aging, diabetes, everything. And also, it is well known that ROS is related to wound healing, but excessive ROS during the wound healing is believed to lead to bad wound healing. Next, please. We have set up a rat vocal fold injury model in which the vocal fold was cut unilaterally. The rat vocal fold is very thin, so we do it under endoscopy. Next, please. And this is the time course of histology. And day 1 and day 3, there are inflammatory cell infiltrations. And after day 5, scarring mechanism occurs after 2 months. And day 56, the vocal fold becomes very thin, stiff, fibrotic tissues. This is a scarring. Next, please. We checked the ROS expression during this period, and we found it's produced in day 1 through day 3. Afterwards, there is no ROS. So we need to control the ROS during this period. Next, please. And also we found macrophage or granulocytes or maybe other inflammatory cells produce the ROS during inflammatory phases. Next, please. So what we do next is anti-oxidant therapy during vocal fold wound healing. We use the same rat injury model of the vocal fold, and we apply astaxanthin. This is another antioxidant. It's belong to carotenoid. And we apply astaxanthin 1 week around the surgery. Next, please. What we found is that ROS is much decreased with application of the astaxanthin on day 1. And next, please. And at 2 months, the sham control shows severe scar with the loss of hyaluronic acid stained blue. But treated groups showed some preservation of the hyaluronic acid at 2 months. So scarring was less by the application of our antioxidant. Next, please. And contraction of the vocal mucosa was also prevented in the astaxanthin group. Next, please. And we checked gene expression in the vocal fold after day 1 and day 3, and there were significant upregulation of the pro-collagen type 1 gene by the antioxidant group. And next one. And also basic FGF was significantly upregulated by the antioxidant. Next, please. So the scenario is that antioxidant can preserve the cells in the vocal fold that is fibroblasts. And fibroblasts produce every extracellular matrix, including hyaluronic acid or collagen. And also we found upregulation of basic fibroblast growth factor. And basically, FGF stimulates the fibroblasts to produce more hyaluronic acid. So this is a good loop to preserve hyaluronic acid after the wound of the Volk film. Next, please. And then Twendee X. Twendee X is the strongest antioxidant consisting of 8 ingredients and recently 15 ingredients for 20M. But anyway, this was developed by Professor Inafusa, and this is a very strong antioxidant. Next, please. And this is a slide from Professor Inafusa. He made radiation whole body of the mouse and then check the ROS inside a system, inside a body. And 20X shows significant decrease of the ROS as compared to the RT only. And the effects of 20X is the strongest as compared to the vitamin C, astaxanthin, or other antioxidant. So next slide, please. Next. And we did a clinical trial based on these evidence. The objectives were to examine the effects of 20X on vocal wound healing in human subjects who were treated by phonomicrosurgery, that is vocal surgery, for vocal polyps, cyst, leukoplakia, or very shallow cancer. The wound is limited into the epithelium or the lesion sites. The design is non-blind randomized trial. We have 2 groups, 20X group treated by 20X around the surgery, and control group has no 20X treatment. Next slide. The schedule is like this. 20X was applied 1 week prior to the surgery and continued for 2 weeks. Next, please. The primary endpoint is the vibratory amplitude of the vocal mucosa because we want to preserve the vibratory property of the vocal. And secondary endpoint is phonatory parameters. We have lots of phonatory functional parameters. Next, please. We have 10 cases for both group, and the diseases were stratified, age are same, and gender distributions are almost same. Next slide, please. This is the representative case. The lower one is the control group. Can you? 1 month after the surgery. Not bad. The vibration is quite normal. The traveling wave is much better. And then can you click the final one? 3 months. So the difference are quite subtle, but this is big impact. So next slide, please. This is actually ongoing project. We have interim analysis with six patients for each group, but our results show significantly better vibratory properly in the 20X groups at 1 month and 3 months. Next, please. This is phonatory function with many phonatory parameters, and loudness is the loudness of the voice. It was significantly better in the 20X group, but there was no difference in the MPT, that's the maximum phonatory time, how long our voice continue. There's no difference. And flow rate, subglottic pressure shows no difference because the difference is very minimal. But next slide, please. And also, global scale is the rating of the voice by doctors, how the voice is. And the lower score is better, and the 20X group shows better rating of the voice. And VHA-10 is voice handicap index. This is a subjective rating of the patients about their own voice. There is no significant difference. And a PPQ and APQ is the degree of hoarseness. There is no difference. The voice is good in both groups, so there is no difference in the phonatory parameters. But the vibratory properties or objective rating shows better in the Twendee X group. Next, please. So this is conclusion. Twendee X leads to better wound healing of the vocal fold after the surgery of the vocal fold. And Twendee X may protect the vibratory properties of the vocal mucosa, which is essential and effective to preserve voice. Thank you for attention. Is there any questions? Oh. Good. Oh, go ahead.
You showed improvement in the physiology of the cords after treatment, but I didn't see any evidence that was actually related to improvement in oxidative stress. You didn't have any parameters of oxidative damage.
Yeah, question is whether or not we checked the ROS before and after the surgery. And this is great questions, but actually we didn't. It's impossible to check the ROS inside the tissues, and the vocal surgery may not increase ROS in the system of the body. So it's really difficult for us, but it's a great question. Thank you. Okay, time is running a little bit late, so I'd like to move to the next speaker.